Hi everyone, I am Beatrice. In today's video, we'll look at angina pectoris. That's just a fancy name for chest pain. At the end of this video, you should be able to know what angina means, how it happens, and the types of angina, what to teach your patient, how to manage the condition. So go ahead, hit the subscribe button, let's begin. So angina simply means chest pain due to myocardial ischemia, where there's decreased blood supply to the muscles of the heart, particularly the myocardium. You should know that angina pectoris is a warning sign of myocardial infarction. Angina pectoris is not yet a heart attack, but it could be a warning sign if it's not properly managed. The heart has three layers. We have the endocardium, which is the innermost layer, myocardium, which is the middle layer that really does the action of pumping of blood. And then we have the epicardium, which is the outermost layer, and that includes the pericardium. The myocardium, which is the middle layer of the heart, does the pumping action. Now, this myocardium is made up of involuntary and striated muscles that contract rhythmically to pump blood. But for it to be able to do this, it needs constant supply of nutrient and oxygen from the coronary artery. Coronary artery is a branch from the aorta, so meaning it's containing oxygen-rich blood freshly oxygenated after it has passed through the lungs. But a situation whereby there's a problem, if there's an obstruction to the coronary artery, depending on the part of the coronary artery that is affected, the cardiac muscle can begin to suffer that decreased supply of oxygen. And if it is not relieved, it can lead to what we call myocardial infarction, which is what we call heart attack, meaning the cardiac muscle can die. The coronary artery itself, we have the right coronary artery, we have the left coronary artery. Each of them does their own function. So depending on the part that is affected, that's the part of the muscle that can die if it is not relieved. Now, the right coronary artery will feed or supply the right side of the heart. So the heart has four chambers. We have the right atrium, right ventricle, left atrium, left ventricle. The right coronary artery supply the right atrium, the right ventricle, and the inferior portion of the left ventricle, that portion where the SA and the AV node meets. The left coronary artery feed or supply the left atrium, the left ventricle, and the interventricular septum, the lateral and posterior wall. So the pathophysiology of angina pectoris, it begins with decreased blood supply to that particular part of the muscles of the heart. Now, this decreased blood supply can be caused, major cause is atherosclerosis, where there's a buildup of fatty plaque in the walls of the artery. So with time, it narrows that artery and blood is not able to properly flow through. Now, with decreased blood supply, it means oxygen demand will be greater than oxygen supplied, and that will lead to the chest pain. So that chest pain is as a result of oxygen supply being less than oxygen demand, especially when there's increased activities. So some of those triggers that can lead to oxygen demand being increased that will cause the chest pain include things like physical exhaustion. At times it could be emotional stress, even cold, or when somebody takes heavy meal, it can trigger that increased oxygen demand, any of those stress. When it triggers it, the person begins to feel the chest pain. Now there are three types of angina pectoris. We have stable angina, we have unstable angina, and variant or Prinzmetal angina. We'll look at them one by one and see how to manage it. First, let's look at the risk factors of angina. The risk factors include, the number one is hyperlipidemia, particularly atherosclerosis, where there is a buildup of fatty plaque in the walls of the artery. Another risk factor is obesity, and then we have family history. Another one can be high blood pressure, even diabetes mellitus. This damages the wall of the artery over time. And also smoking and use of some drugs like cocaine, caffeine, excess use of it can cause those constriction, especially for Prinzmetal angina, the variant angina, where there will be spasm of the coronary artery. Another thing is renal disease. So these are vascular disease. This can cause also vasoconstriction of the coronary artery and spasm. If you are enjoying this video, I want you to hit the subscribe button and also like the video, leave your comments. Now let's look at the types of angina. Stable angina, so as the name goes, it says stable angina, so it's stable. The fatty plaque is stable, so it has not ruptured. So it means it's predictable. The patient can easily know when it happens. Most time when you ask them, they'll tell you when I'm stressed or when I'm doing exercise or doing an activity. So they can easily predict it. Also, it doesn't last for long. It's shortly, most time less than 15 minutes, and it's not repeated in most cases. And then it's like I mentioned, it's predictable, so it occurs with exertion. Most times, patient can easily explain to you how they are feeling and how it happened. Now it's relieved by rest. So most time when they rest, the pain goes. But at times if it doesn't go, they take nitroglycerin and then they'll be fine. Nitroglycerin is a nitrate, a vasodilator. It will lower the heart rate. How to take the nitroglycerin for chest pain, we'll discuss it shortly. Unstable angina is the second one. As the name goes, is unstable. So this one is unpredictable. In unstable angina, the fatty plaque has ruptured. But as it ruptured, platelet quickly move to that side, trying to see if they can fix the problem. That's what we call platelet aggregation, but that will lead to blood clots. And that blood clot can further cause more problem. It can block some part of the coronary artery, cutting off blood supply. And this one can actually lead to myocardial infarction, heart attack, if care is not taken. So for this unstable angina, like I mentioned, is unpredictable, so it can occur even at rest. And it lasts longer, it can last more than 15 minutes, and it can be repeated. So this one is a medical emergency, because for this one, it's not relieved by rest. It's not also relieved by nitroglycerin. So because of that, a patient that is experiencing this, we need to call 911, call EMS, and come straight to the hospital. This is a medical emergency, so that heart muscle will not die, will not suffer myocardial infarction. The third one is variant angina. So for variant angina, this one happens often most time at rest, maybe at night or early in the morning. And it's due to coronary artery spasm, where the coronary artery begin to experience spasm. Like in cases where a patient smoke, or in renal disease, any of those caffeine, cocaine, some of those drugs, they can cause spasm of the coronary artery. Then there can be transient ST elevation. There could be EKG changes, but it will be transient. It's not going to be that much. So generally, the signs and symptoms of angina that you want to take note of for your exam, there are some terms they use you want to know. So there will be chest pain or pressure. Some of the points you hear is substernal chest pain. This substernal chest pain may radiate to the jaw, to the arm, or to the back. Now, there's a term I want you to take note of. The pain could be crushing. The patient could describe it as crushing, tightness, squeezing. And also for patients like in women, the patient may not describe this substernal chest pain or may not describe this crushing, tightening, or squeezing pain. They may just describe it as discomfort, chest discomfort. Some may say not mention nausea, vomiting in addition to chest discomfort. So you could suspect that it could be angina. Management of angina, nursing intervention. So for medication used in managing angina, we use nitrates. That's the first one. For a patient that's having angina while at home, we teach them to take nitroglycerin, 1 tablet every 5 minutes, up to 3 tablets, meaning up to 3 times. As they are taking it, they are checking the chest pain is still there. But after taking it up to 3 tablets, 5 minutes interval, the pain is still there. They should call EMS, call 911 immediately and come to the hospital. So nitrates is a vasodilator. It's going to dilate the blood vessel, so it lowers the heart rate. It also lowers the blood pressure. Beta blockers is also used. So it lowers the heart rate and also lower blood pressure. Calcium channel blockers can be used to calm the heart. And then aspirin, because of platelet aggregation. So platelet aggregation can cause obstruction in the blood vessel, especially the coronary artery. Another medication is statins group of medication to lower the cholesterol, because most times the plaque is a major cause of angina pectoris. And we know that this plaque, it depends on the location. If it is confined to a place, most times it may end up as just stable angina. But when it dislodges, it can cause unstable angina. And that is a problem, because unstable angina is a potential for myocardial infarction. Now, teaching. I have mentioned earlier, you should teach the patient to take nitroglycerin 1 tablet every 5 minutes. Take it a maximum of 3 tablets. Also, if the patient is in the hospital, let's say it is unstable angina and the patient is in the hospital, we put the patient on cardiac monitor. We want to check for those changes, to be observing it. Most times there may be some slight change in the ST elevation, depression, and also there may be, when they do some blood work, they may see troponin, which is a protein that is released when the cardiac muscle dies. So it may be troponin. At times there may not be, except maybe myocardial infarction has actually occurred. Diet. The patient should take diet that is low in fat and low in sodium. They should be strictly on low sodium and low fat diets. Then we should teach the patient to stop smoking, stop taking those drugs like caffeine, cocaine that will cause any of this problem. Then they should manage any chronic condition, diabetes, hypertension. They should manage it very well. And they also should ensure that they eat healthy. Obesity is one of the causes, so they should manage their weight properly. Then they could do surgical intervention, what we call cardiac catheterization, to open up that coronary artery. So that's all today's topic on angina pectoris. If you find this video helpful, please like, share this video, leave your comment, and subscribe for more educational videos. Thanks for watching.